to my elbow, all right? I then bring my hand across, bring your leg just a little bit, thanks. Okay. So he should be relaxed. If he is contracting the muscle, you're not going to be able to mobilize very well. So get them to relax. It's not a football, so you don't want to squeeze the head and rotate it. You got to keep it nice and relaxed. Let him relax his head right into the elbow area. Take your middle phalanx, and you're going to go right over the spinous process. So if you need to flex them forward to find the area, go ahead and do that. All right, but then bring them into a neutral position. Take up the slack, and you're going to hook your middle phalanx is right underneath that spinous process. Okay? A lot of people are going to come over to the side. You can do unilateral if that's what you're trying to do, but right now to get this, go central because it's much easier. All right? So I'm going to take up the slack here. You'll see that I'm going to cover about 2/3 of my pinky with my thenar eminence, and I'm going to find his end range. All right? And then I just back off, mid to end range. How's that feel? See? I talk well. So it's mid to end range, nice and easy. If you see this kind of a thing, this on-off, it's not right. That means you're going in the beginning range. All right? You really got to take up the slack, find that end range, and mid to end range. Nice, easy oscillations. Then you can go down a level. Nice, easy oscillation. You can scratch his back too if that gets him to relax. All right, and then you always get the shoulder. All right. Hand placement is middle phalanx and thumb pad. All right. My elbow is going to be dropped below the segment that I want to mobilize. The reason is what is the degree of angles in the thoracic spine? 60, 65, around that range, right? So you want to be able to guide your direction of force at that 65-degree angle. If you use their eyes, it doesn't matter where you are in the spine, if you use their eyes, you usually get the right treatment plane. Okay, so it's important to have them in a good seated position. Don't let them flex forward. You got to get them in a good seated position, but comfortable. You can modify some things, which I'll show you after. It's not a pure mulligan technique, but sometimes you get these real big people that you really need to do this technique and you can't get around. So I'll show you how to modify that. But, so the elbow is dropped. You're on your segments that you need to mobilize. All right, in the direction of force, again, mid to end range. Tough area to mobilize. Like I said, if you're talking and doing it, you're probably not doing it right. You're going to find the end range, and then you're going to mobilize mid to end range in this direction. All right? Ready? This one feels good. Okay, so I'm here, and I'm here. Contact points are here. All right? I'm going to find his end range as I come up here, and then I mobilize. You get a good ab workout on this one. It's a little bit more aggressive than the other ones, and you're going to see a lot of skin movement, so you really got to get the end range and then mobilize, all right? Does that feel all right?
You're 1 second down.
This is what they'll say, too. Right there. All right, and you mobilize. Now, the other thing that's hard to do is keep this arm relaxed. You will definitely start to do this. All right, and you're doing an eval on him, right? You've done your evaluation, and what you found is that he has limitation going to the right. Say he hurts or he gets pain and limitation when he turns to the right. You are going to mobilize into a right rotation. So wherever he has the limitation is the area you're going to attack first, okay? And again, don't get caught up on this, but if he has rotation issues but his pain is on the left, my hand placement will be on the left. That's where I'm going to start. It doesn't mean that I never go to the right, but I'm going to go where he gets the pain, but he turns his head into the side of limitation. All right? So you're all a little confused. So remember this. You always want him to turn into the direction of limitation. That's where you're going to start. If he gets pain to the right side with that, I start to the right side. If he gets pain to the left side when he turns, I place my hand on the left. Okay? Basically, the theory on this is that there is a positional fault here. So if you're C4 moving on C5 and you turn to the right, what does C4 do on C5? Goes down, right? So if I'm C4 and his head is C5, when I turn to the right, we should all start to go down to the right, correct? What Brian is saying is that there's some positional fault there. and that he's already, C4 is stuck down on C5. So when he goes to rotate to the right, there's no room for that to go, so he's having pain. There's no sliding or gliding availability on C4 to C5. So what he's going to do is he's going to say, all right, on my mobilization, I'm going to bring him back where he belongs, all right? So now C4 and C5 are resting correctly, and as he rotates, I'm going to allow it to come down, all right? But I'm going to facilitate it. I'm going to correct it first and then allow it to come down. So when you do these corrections, when these mobilizations, and I'm going to show you, when you mobilize in that superior diagonal direction, I'm correcting the positional fault, but when he turns, I have to go with him. Otherwise, what do? Now you're going to jam him up. So you have to correct and then rotate. You see that? Okay. So, I don't know if you guys can see, but you're going to probably may have to move a little bit. If he's, again, rotated to the right, I'm going to use the distal part of that medial pad of my thumb, all right? I'm going to go out to what Brian calls the articular pillar, near the in between the transverse process and the spinous process. That's my contact. So if we're going to the right, my contact thumb is my right, because when I mobilize my left thumb here, I want to push up and out. If I reverse that, what's going to happen? I'm going to compress the segment, all right? You'll make this mistake once, and then you're going to figure it out because you can visually see it. So middle part of my thumb here, thumb pad like this. My contact and mobilizing thumb is my inferior thumb. I'm going to push up and out, all right? So if he's compressed down this way, I'm going to push him up where he belongs at that oblique angle. Then I'm going to hold that. As he starts to rotate, I go with him. You'll see my hands move. I rotate with him. This is where he's going to do end range overpressure. So as we are going, and he should have immediate results, all right? He starts to turn. Once he gets kind of where he's got soft tissue limitations, he needs to do overpressure into that direction. Now this is important because you get lasting effects, but also you got to look at his positioning. A lot of times people do this, which is side bending, or they go into a quadrant. You have to have that pure rotation, all right? So let him go to the side of his head. Don't go to the jaw. You know, sometimes there's TMJ problems there, or you don't get a good rotation. Up to the side of the head, and pure rotation, no side bending. If they were having problems going into a quadrant, then that's what you want to work. But right now, we're doing pure rotation, okay? So, I'm going to place my thumb here. I do my glide here, and it's an upward direction. So, these two fingers are not choking him, but I do get a little bit of counter pressure here. You should not be doing this, all right? So it's here, and it's here. He should feel an upward direction. So you get through the soft tissue, do the mobilization up. I maintain this. Go ahead and turn to the right. He goes to the right. I go with him. He uses his right hand for overpressure. Right hand for overpressure. He just did everything your patients are going to do. All right, here, and then you're going to do overpressure. All right, let me go back, though. All right, so we go here. I'm going to go up a little bit higher so you can see a little bit better. Apply the glide here. Go ahead and put your hand on your side of your head. Go ahead and turn and do overpressure. Good. And then back off a little bit and do 10 of those. They don't have to go all the way to the beginning if you're working end range. All right? Good. And then relax. So let's say you do 10. All right? So you should see immediate change. And usually what they'll say is, wow, I haven't been able to turn that far. And then they let go. You got to make sure that they pay attention, that they're doing that overpressure, and that it's correct. And a lot of times, you'll say, just what I did. No, here. You actually got to get it in there and show them from the beginning. All right? So again, here, contact. Here's your glide up. A lot of times, you're going to find that you just push horizontal. That's not right. You got to get up. There's his eyes. There's the angle that I'm applying my glide. I go up here into the soft tissue, up. He turns to the right. I go with him. He does overpressure. All right?
Do you usually do this on a treatment table or